guys. Well, thank you again so much for having me. This is my second time getting to speak to a Cancer Bridges group. As Jen mentioned, I'm excited to be back. My name is Emily Cottrell. As Jen mentioned, I am a double board physician. I practice two specialties. I practice family medicine, which is all ages primary care, and I'm an adult psychiatrist technically. And I'm excited to be here. So I am going to share a little bit about what we know about the trauma related to being diagnosed with cancer. Anytime we try to look for solutions or look for ways to cope or look for ways to be proactive in treatment or in addressing a problem, I think knowledge is half the battle. So if we can educate ourselves first, and then we can figure out what to do and how to problem solve about it. So I have a few slides to share just about the education piece. And then I was hoping at the end I could get some feedback from you guys and maybe chat a little bit about the action piece, the solutions piece. So I will go ahead and share my screen. And again, I don't intend to take up the entire sort of next 45 minutes with slides. I won't bore you to tears, but I hope these are helpful for you. Let me pull up my screen here, my PowerPoint. All right, cool. Oop, go back to the beginning. There we go. So everybody can everybody see my slides? Are we good there?
Mm-hmm. Yes.
Okay, great. Well, again, thank you so much for having me. This is me. This is how you spell Cottrell, the illustrious last name that nobody says, that I don't say correctly and nobody else does either. And thanks again. There are a couple of things I just want to say about my job, why my job is important to me, why it was important to me that I train both in medicine and psychiatry, and that'll help you kind of understand a little bit more about the context of why I'm talking about this topic. It's intentional that I work the way that I do. It's intentional that I work as a behavioral health specialist in a medical setting. Because I have both sets of knowledge, it is I think an honor and a privilege to be able to work at how they interface, how the mind and the body connect and influence one another. It's a unique set of skills and a unique experience, but I feel very privileged and honored to be able to do it. So it's all very intentional, and I'm hoping that by recognizing the emotional trauma and naming it and calling it out and calling it what it is, related to being diagnosed with cancer, that then we can start to reduce some of that trauma, start to reduce some of the intensity of emotion that goes with it, so that people can prioritize quality of life, amongst other things, after a cancer diagnosis. So the first thing I wanted to bring up, this is a picture this is actually the cover of a book, a very frequently used book by physicians and medical professionals. It was written by a palliative care and hospice physician, basically to teach medical professionals how to talk to patients about bad news, how to deliver bad news. This seemed like an apropos way to start. And this is like a brief aside about the importance of the way that we as physicians deliver frightening or life-threatening or extremely emotionally sensitive information to our patients, because it's absolutely pivotal. And actually, the way that physicians or other medical providers, doesn't have to be a physician, the way that we deliver this news or the way we deliver this information actually is very much associated to the amount of trauma that people tend to experience around their cancer diagnosis. And sadly, we don't get it right all the time. Like, providers just don't get it right all the time for one reason or another. Either they're too rushed, they're too uncertain, any number of things. It's not delivered in a very sensitive way. It's delivered very quickly and then followed by tons and tons and tons of other information. So we have a huge impact on the way that we deliver so information as serious as you have cancer to a patient. And sadder still, you, our patients, don't have any control over that. You don't have any control over who diagnoses you and under what circumstances and how quickly it's going to happen and whether you're prepared or not. So I say all that to say, just to give a little nod to the fact that a lot of the trauma that people experience related to their cancer diagnosis has to do with the way the information is delivered, and that is beyond your control. However, we are going to talk about some things that are within your control to try to address or cope with more effectively as you cope with what's happened here. But I just want to put a plug out there for that, because the way we behave as medical professionals is really crucial. The book is excellent, by the way. I think all physicians should read it for sure. So this is something we can I just want you to ponder about as we go through this presentation, and then maybe we'll have some time to share at the end. I would also suggest that anybody who does not feel comfortable sharing what their own experience was like, because it's a very personal and very private thing, just listen. You are not obligated in any way to share information about what your experience was like when we get to the end and we're not recording anymore. But I'd like to take each of you to take a moment and just recall what your experience was like when you were first told you had cancer, and how much of those details of that initial discussion do you remember? Because I guarantee you were given a lot of information at that time. I think probably what you're more likely to remember is what emotions went with it. Like I say, this experience can be extremely private. It can be something you feel comfortable sharing. Maybe you've shared it many times before, but it's unique to each and every individual. And like I say, the things that tend to stick out in our recall, the things that we remember about these types of stressful situations, and I'll give the term trauma to, are the emotions tied to it, not so much the information we're given. So what do I say? What do I mean when I say trauma? In this case, it means a direct reaction to a stressor that exceeds an individual's capacity to cope with what's happening. And I often explain it to my patients. I treat a lot of patients with trauma disorders. I often explain to my patients, like, this is an experience that overwhelms your normal defenses, emotionally speaking. Like the person who's kind of going along, doing okay, keeping their head above water, coping day to day to day, and then something hits them, some experience occurs that absolutely overwhelms their ability to cope and continue functioning like they had been. Okay. So what do I mean by a stressor? Like, what kind of event is this? And this is actually something of debate over the years within the mental health treatment community. It used to be in sort of previous versions of our diagnostic manual that we use as mental health professionals. It used to be that there was a really narrow definition of what met criteria for a traumatic stressor, what could cause trauma. They've since really broadened and expanded that definition. And incidentally, September 11th was one of the sentinel events that changed the way that we understand trauma. We started to understand that we could experience vicarious trauma. So meaning like the traumatic event itself happened to someone we love or someone we care about, and that can be traumatic for us. So for example, if I have a loved one who's diagnosed with cancer, that can be a trauma for me, as well as the person who's directly experiencing it. So a traumatic stressor, as we know it and understand it today, can be any event or multiple events. It doesn't have to be a single event that may cause or threaten death, serious injury, or sexual violence to an individual, a close family member, or a close friend. So that's directly out of our Diagnostic and Statistical Manual of Mental Disorders, or DSM, which you don't have to remember, but that's like our mental health cookbook. It's like how we know who meets criteria for what illness and how do we decide how to treat them. So a stressor can be just about anything, as long as it's perceived to be threatening, right? As long as it compromises your safety, which certainly a cancer diagnosis does that. And understandably, many people experience really intense emotion or even dissociation. Just so, what I mean by dissociation is like a period of lost time in which your body is present. You're present in a room during a conversation, but you don't recall it. Your mind is not sort of codifying or incorporating those memories. You don't recall the information, typically as a consequence of you having your defenses overwhelmed. So that can happen during during the initial conversation in which somebody is diagnosed with cancer. And like I said, like I mentioned earlier, the details of that conversation may be very fuzzy. We actually, some of the research that physicians look at when we talk about delivering quote bad news or a life-threatening diagnosis, on average, the average patient that we discuss a diagnosis like this with, when they receive a very serious health diagnosis, they only retain about 10% of the information we give them. So if we fire off tons and tons and tons of medical bits and details, it's not likely to be remembered or at least recalled to any great extent, because there's so much emotion going on, and or the person may actually truly be dissociated, like may not even recall parts of the conversation at all. So those are things that I just want people to be familiar with. And the other thing is, this is really, really common. There was one study that looked at patients who were in treatment for breast cancer. 9 out of 10, 91% of those patients reported at least one treatment-related traumatic event. And often the actual conversation or the day of their diagnosis was one of those traumatic events, the way in which they were diagnosed. So this is really common. Okay, and I'm sure this is like not a surprise to any of you, but the range of reactions, especially negative reactions, ones that are harmful or hurtful or distressing, one can experience when being told they have cancer is really quite broad. Lots of negative emotions represented there, which you can see, of course. And then, of course, in addition to the emotional pieces, there's a physical response associated with this, just in the same way that somebody who's presented with a life-threatening traumatic event like a car accident or a fire or something like that will experience as well. It's like it's our sympathetic nervous system in absolute overdrive. So people will describe elevated heart rate, fast breathing, shortness of breath, choking sensations, sweating, numbness, shaking, just like you would if you were in fight or flight mode during the actual conversation in which they're diagnosed. People can also report experiencing alterations in their thinking. So the dissociation event, like that we talked about, confusion, disorientation, kind of mental brain fog or cloudiness. And we know that these trauma symptoms, if they are sustained, can negatively impact the quality of life and even reduce the success of the treatment, particularly through avoidance of medical care, which is one not so healthy and not so adaptive coping mechanism that can come through here. Okay. Can everybody hear me okay? It may have cut out there briefly.
Yeah.
Okay. All right, cool. There was one message in the chat about dropping off. Okay. All right, cool. So let's go to the next slide here. And again, like I said, these are really common emotions. So 41% of patients report, depending on the study you look at, but this is roughly in the ballpark. 41% of patients report intensely distressing reactions, specifically during the moment of diagnosis. Now this is where it gets kind of interesting to me, and maybe we can kind of chat more about this in the end, but only 4% of patients, again, depending on which study you looked at, but it's consistently less than 10%, are diagnosed with cancer-related PTSD. Now I want us to think about why that is. If nearly half of patients are saying, I had a trauma response, when I was diagnosed, specifically around that event, why are only 4% being diagnosed with PTSD? Now, and we'll talk a little bit about that. One element to this is that in order for somebody to be diagnosed with PTSD, their symptoms have to persist for more than a month. So that's one. One explanation could be that a lot of the folks who initially experience really intense sort of emotional trauma response to being diagnosed, those symptoms dissipate or they lessen to the extent that they're doing relatively well from a functional standpoint within a month. So that's possibility. The other thing I would allege, and I'll pull it up on the next slide here, is that it's just under recognized. PTSD that is specifically related to being in cancer treatment is under recognized and it's underreported. It's under screened for, meaning we just don't often ask. Medical providers don't often ask about it. Again, because I work doing mental health for medical patients, I can't tell you how commonly I diagnose PTSD related to medical care, hospital trauma, and so on and so forth. It's really under recognized and therefore it's underreported. The other thing is this is a little more complex than the person who has like a single traumatic event, like a car accident, for example, and then goes on to develop symptoms of trauma and PTSD. I think as a human race can understand that. It's something that's been characterized for a long time, starting with combat veterans, military trauma. So what I think people have a harder time, and included by people, I mean also medical providers, right? Like the medical system has a hard time understanding complex trauma in patients that have long-term, chronic, repeated exposures to those traumatic events, particularly following a cancer diagnosis. Because if you think about the whole journey, it's repeated contact with the provider who diagnosed you, repeated contact via appointments and scans and long stretches of waiting and lots of anticipatory anxiety. So folks really can develop long-term traumatic responses that are harder for, I guess, the medical system to pin down and diagnose unless you ask, right? So the other thing, and just an important point, I know you guys all know this because I'm like preaching in the choir here, but but in this case, treatment is trauma. So, and that's a really important point. The things that your providers are telling you to do to improve your health, to fight the cancer, to be well, to be active in your treatment can be traumatic. Every time you step into an MRI or a CT, or every time you have to walk into the infusion center, there can be a trauma response. And so that we're directly encouraging patients to do the thing that can cause them distress. So that it's unique about medical trauma and about being in cancer treatment. So again, I think it just doesn't get characterized in the same way or identified the way other trauma disorders and PTSD do. And it's interesting to that, there's even studies that look at in patients whose cancer is in remission, so whose treatment is completed, how these trauma symptoms can actually persist for the entirety of the rest of their lives when it comes to interacting with the medical system particularly. All right. And of course, again, not a surprise to anyone in this group because you guys are the experts, right? Cancer-related PTSD affects all aspects of one's life. It affects their self-image, it affects relationships, their spirituality, their work, their, on and on and on and on, their schoolwork, their interactions with their family, their self-efficacy, their ability, their belief in their ability to be able to accomplish things on their own, their beliefs in their inherent strength, it really makes people question every aspect of their lives. And of course, being diagnosed with cancer alone is a very isolating event. It's a very isolating experience. Makes folks feel like they don't belong. They become other. They've lost a community that they feel like they can no longer relate to. Folks report often feeling lonely, feeling abandoned, feeling marginalized, or feeling, like somebody who's in I guess I would say a minoritized group, somebody who then is ill or disabled who wasn't before, for example. So now that we're kind of armed with this information, and as I said earlier, knowing is sort of half the battle, and then we figure out what to do. How do we shift the trauma and the emotional intensity of a cancer diagnosis into strength and adaptation? Okay. So there's this concept that I'm just going to introduce just for the purposes of kind of, and I won't go into like all the theory behind in details, but just a concept I want to introduce called post-traumatic growth, which is basically the idea that after a traumatic event, such as being diagnosed with cancer, there is a way to shift that paradigm of negative emotion and of feeling other, feeling disconnected, feeling like you've lost the qualities that were previously yours to claim, and shifting that into a positive change, or benefits that can be derived from the experience of a trauma. And the reason this is a model that's used a lot in folks who've been through traumatic events is because the other side of it, like the development of post-traumatic stress disorder and post-traumatic stress symptoms, are predictive of more likely folks who are going to suffer depression and impairments in their quality of life, and also engagement in their treatment, the success of their treatment as well. Okay. All right. So I will actually, let me hang on to that question until the end. There's a question in the chat that I will just hang on to until right at the end, but I'll make sure to come back around to it. Okay. So this is the idea. This is a body of research that's been looked at by not just in folks who are going through cancer treatment, but also anybody who's suffered trauma. What was that? I'm sorry.
I think that was just a bloop.
Oh, okay. Are we good now? Okay.
Yeah.
All right. So the idea of the actual study, the research behind how do people go through traumatic events and then come out strong, adaptive, utilizing those post-traumatic growth precepts, it's called resilience. It's like, how does somebody suffer something and then come out turning it into some degree of benefit or positive outcome. And resilience is then an individual's ability to maintain or restore relatively stable psychological and physical functioning when confronted with stressful life events and adversity. That's like the big sort of long-winded definition of it. But a lot of the research that looks at how do we support folks and help foster their resilience and their strength as they are dealing with the trauma associated with being diagnosed with cancer, like it really centers on this principle. And in fact, I would suggest that one of the most important things you guys are already doing is participating in groups like this, right, that are built around these concepts, and supporting one another, creating your own community here. Because resilience in cancer treatment helps to create meaning, a sense of meaning and purpose in life. And maybe that's a new meaning and a new purpose, given your life is different pre-diagnosis and post-diagnosis. It also helps to foster a sense of coherence. And what they mean by that actually is the concept that sort of roughly there is a purpose or a meaning behind you or attached to being diagnosed with cancer within the broader construct or global idea of your sense of purpose, that there is meaning attached to it, within the broader meaning of our existence, our purpose on the world, a sense of optimism, a sense of positive emotion, building self-esteem, building self-efficacy, which is of course our ability to feel comfortable and confident in our capabilities, our ability to problem solve, our ability to tackle a challenge, the things that we're good at, the things that we are complimented for and lauded for. Cognitive flexibility, so the option or the openness to be able to adapt to challenges and problem solve and change direction. Positive coping in general, social support, and spirituality. So folks that are engaging in programs that are specifically targeted toward building and fostering resilience, again, like the groups that you're doing here, are directed toward that post-traumatic growth. So this is like the transition toward positive change that comes after a traumatic event. And folks that are participating in these types of programs, whether they're formal or informal, will then report they have an increased life appreciation, renewed or altered life priorities, an enhanced sense of personal strength and self-efficacy, like we talked about, improved social relationships, the perception of new possibilities. Like I mentioned before, there is a tendency toward, this is obviously a huge sentinel event in your life. So there's a tendency to think about life in terms of pre and post diagnosis. And the post-diagnosis meaning and purpose in life may be different, may change, new possibilities may open. And often folks will report developing a deeper sense of spirituality and personal meaning as a result of their diagnosis and as a result of participating in programs that enhance or encourage post-traumatic growth. Okay. All right, so this is a book that's actually written by a physician as well, and it actually is worth checking out if you looking for a read that's related to this on Amazon, called Roads to Resilient Meaning and Resilience with Cancer. But basically, the idea of building resilience from the time of diagnosis is absolutely imperative, absolutely pivotal, as we help support folks through their cancer journey, because these precepts are ways to foster adaptive coping throughout, and reduce the likelihood of having symptoms of post-traumatic stress, depression, and anxiety related to your cancer diagnosis and treatment. So of course, these precepts sort of build around managing how we manage stress, which I think is a lot of what your wellness group is doing, coping skills that are positive, mindfulness and appreciation for what's in the moment, just existing and being, and goal setting, of course, like finding new avenues and new opportunities. Okay. So I will actually stop sharing my screen so that I can pull up. Let's see. Jen, do you think we should stop the recording, or do you want me to go ahead and read there was one question in the chat I was going to read out, but I won't say.
If you're done presenting and you want to interact, we can just stop it.
Okay. Yeah, let's go ahead and do that.